Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter M. Today I'm not going to talk about any diseases associated with M, but I call it medical reasoning. It's on the generalized how to think as a physician, but you're a patient or a general population, how to think, how to reasoning about yourself in terms of mental wellness and also the physiological health, how to reasoning to adapt in this fast-paced lifestyle and also the variety of products, how to reasoning and to choose the right for yourself. I still think the medical reasoning is different from the mechanics or from the computer programmer or from any other science. The reasoning from medical process, I think, is kind of dimensional, multiple layers, and also it's dynamic, have to be and individualized. So you put everything together to treat everybody, individual patient. Like I think I mentioned before, the same problems, the same symptoms or the same diagnosis, however, the management is different. Why? This is because of the dynamic and dimensional as an individual, so that's the individualized management. So the medical reasoning, I give you example for me or for probably it's in all the physicians or majority of physicians or anybody with medical background. The reasoning is kind of really fast. For example, a patient come here, middle-aged, with fever. So the physician, while talking to you, actually the brain is running fast. Running fast, that like flying all the information. What can cause the fever in this middle-aged female, for example, and then at the same time listen to your history and ask your questions, listen to what you said, and narrow it down, just like everything flying to the brain, and then discard that, and eventually dance into the diagnosis, narrow down the diagnosis, of course not finalized until the lab or the laboratory test or the relative physical exam. But this process is quick, it's in couple seconds or minute. Have to have this, of course, from the knowledge, training, and experience. So this is for the general population. I recommend you know the body, know yourself with some fundamental knowledge. So for yourself, for example, if you're a young person, you have a chest pain, I encourage you to look up or to know what is in the chest, what is in that particular position of the chest. For example, you have the right chest pain, you're young, without any history of hypertension, diabetes, without any family history of premature cardiac death or a genetic cardiac disease, has been healthy, but suddenly you feel your right chest pain without fever. What are you going to think? How to reason this? And probably because of the information technology is so available, I probably start from the beginning. Look at what is in that area. What are the organs? So you know there's a skeletal muscular, the ribs, the muscles, and then deeper on the right, there's no heart. So you know it's not heart disease because the heart is not there. And then you look on there's a lung, and then you look at the most serious condition can cause the right chest pain in the young people, the lung disease. What kind of lung disease? The painful probably is the pneumonia, the lobar pneumonia, or the pleuritis. And then you search all those diseases has to have symptoms like coughing, fever, and you don't have it. And then you narrow down whether you press it or not press it. When you press it with the pain, then you narrow down it is the muscle, skeletal muscle around that area cause the pain. So this is this is a very simple, straightforward example for the healthy young people. as a matter of fact, in the real life, in the medical clinic or hospital, the situation is far beyond this simple problem. I'll give you another example. It's like 70 years old male with a past history of diabetes, hypertension, hyperlipidemia, developed this right side of chest pain. It could be the same as the young people, the skeletal muscle or just the rib or bone pain if you press it. However, for this older people with complicated past medical history, so the physician's mind first runs through is the vascular disease or pulmonary embolism or medication caused or anything, or could be variety of diagnosis. So it's not just like what I told for young people, you have right side localized chest pain. Then this 70-year-old, the same symptoms, but because of the past medical history, the medication history, and complicated the problem. So the physician will just approach this patient in totally different way in terms of the reasoning process, in terms of the knowledge and experience to apply this case. So my point, probably I did not say it clearly, but I hope that everybody, particularly when you're young, to know yourself, to learn about the organs, the systems, the basic functions, the diseases, because it's convenient nowadays. Really, it's convenient. Not like 3 decades ago. 3 decades ago, the medical knowledge is not that widely available. Now you can just Google everything. So find it out and to know it. The benefit for this is not just only to the population, to the patient themselves, also to the physician. So when physician talk to you, make the communication easier, and make if the patient is very well educated themselves, know the body, know the function, know the structure, know the disease, so that physician talk to you, then I think the communication is much easier for both sides. And my point is the reasoning process. It's a dynamic, dimensional. If you know the body, if you know how the body is running in terms of interactions between the heart, the vascular, the endocrine, and the kidney, and if you know this knowledge, fundamental knowledge, then the disease, you will know the disease process, you will know the mechanism, and you will know how to maintain well-being in terms of mental health, and also the whole body as an organism and generalized health, well-being. So this is quite complicated. I did not prepare. I just this concept came to me because recently I saw some information about diseases and different people has different management, and also I saw young people running around kind of confused whether what kind of health, what kind of conditions need what kind of management. So I just sit here, thought about this topic. Probably I did not say it clear, but my point is know yourself, know the body, know the organ, know the system, know the interactions, know the mechanism of disease. Even though you're not pursuing medicine, but this is good for you and also good for the physician. So that's the point. Because the reasoning method and also the dynamic, dimensional thinking, the way of thinking, will really make difference. So I think it's the video is longer than I thought, and also I hope it helps, and I hope I address my point clearly. Probably not, but I will just try to see whether I can make some addendum on the attached with this video. Thank you for watching. I will see you next time.